essential surgical procedures. Things like dental procedures, like extractions, so important. Basic obstetric and family planning procedures like cesarean birth, vasectomies, fistula repair, general surgery, such as circumcision, appendectomy, hernia operations, and treating various types of injuries and congenital physical conditions are part of it.
There's a very large burden of disease, and that's primarily and extensively treated through surgery. If full provision of essential surgical conditions was given, that this would avert about 1.5 million deaths a year, or 6 to 7% of all avertible deaths in low and middle income countries.
That 6 to 7% estimate is also way too low. This comes from one paper that looks at exactly what you said, Jess. It looks at the number of avertible deaths from a limited set of surgical procedures at the first level hospital. But overall, that 6 to 7% number is essentially us telling the world, hey, 94% of your diseases don't need us. If we go back to the definition that we were using before, which is a disease is surgical if surgical decision-making is required at some point, then that number jumps from 6 to 7% all the way up to 30%.
Underneath the deaths, where surgery really shines is in averting disability, right? Think of all, the kids born with cataracts that are blind and you make them see, right? Think of all the injuries, the fractures that you fix. Think of all the club feet that you fix, all the clefts. You're averting a lifetime, right, of disability. So yeah, so I think that any figure that fails to really account for the amount of disability that surgery can avert is painfully inaccurate.